So Alberta's emergency rooms are packed tighter than a Tim Hortons drive-through on Free Coffee Day, doctors are waving red flags like they're directing traffic at the Calgary Stampede, and the UCP government's response? Radio silence louder than a hockey arena when the opposing team scores. Welcome back to Canadian Insights, where we break down the political circus one popcorn-worthy story at a time. Today, we're talking about Alberta's ER crisis, because apparently watching paint dry in a waiting room for 12 hours has become the province's new extreme sport. The Alberta NDP just dropped what might be the political equivalent of a group text calling someone out in front of everyone. Sarah Hoffman, the opposition's hospital services critic, stood up on Monday and basically said what every Albertan sitting in an ER waiting room at 3 a.m. was thinking. Where the heck is everyone? Not the patients, obviously. There are way too many of those. I'm talking about Premier Danielle Smith and her 4 health ministers. Yeah, you heard that right. 4. Alberta has 4 health ministers, which sounds like they're running a healthcare system by committee, and apparently all 4 of them decided now was a great time to practice their best impression of a ghost. Hoffman didn't pull any punches either. She said the UCP is still operating in vacation mode, which is a diplomatic way of saying they're treating a healthcare crisis like it's an extended long weekend. Imagine your house is on fire and instead of calling 911, everyone in your family just keeps posting Instagram stories about how concerning the flames look. That's essentially the vibe we're getting here. The Alberta Medical Association, which represents doctors across the entire province, has been sounding the alarm so loudly you'd think they were trying to wake up someone in a coma. They're straight up saying patient care is at risk, which in doctor speak is basically code for things are really, really bad and we need help yesterday. Now let's paint a picture of what overcrowded emergency rooms actually look like, because it's not just an inconvenience like waiting for your Uber Eats order. We're talking about people camping out in hospital hallways because there literally aren't enough beds. Picture this, you show up to the ER with a legitimate medical emergency, and you're told to grab a seat because the wait time is longer than a Marvel movie marathon. Except unlike a Marvel movie, there are no superheroes showing up to save the day. Just exhausted doctors and nurses trying to perform medical miracles with duct tape and determination while the system crumbles around them like a stale Timbits donut. The NDP is essentially demanding that Smith and her health ministers acknowledge there's a crisis happening. Notice I said acknowledge, because apparently we're at the stage where we need to convince the government that yes, hospitals bursting at the seams with patients is actually a problem. It's like trying to convince someone their kitchen is messy while they're standing ankle deep in dirty dishes insisting everything's fine. Hoffman specifically called out the lack of resources being directed to the front lines, which is where the actual work happens. Not in press releases, not in carefully worded statements that say a whole lot of nothing, but in those chaotic emergency departments where healthcare workers are pulling double shifts and praying for reinforcements that never arrive. Here's where it gets spicy. The NDP says the UCP keeps putting out statements but won't make themselves available for questions. In politics, that's what we call the tweet and retreat strategy. It's when you want credit for acknowledging a problem without actually having to answer difficult questions about why the problem exists or what you're going to do about it. It's like posting a heartfelt apology on social media and then immediately turning off your notifications. Very brave. Much leadership. So inspiring. Hoffman dropped the phrase "the buck stops with them," which is political speak for y'all are in charge so you don't get to pass the blame to someone else. She's demanding accountability, which is a reasonable thing to expect from the people running a province of almost 5 million people. When healthcare workers are literally begging for emergency measures to cope with the overflow, maybe it's time for the folks at the top to put down their talking points and actually show up. Let's talk about what emergency measures could look like, because spoiler alert, it's not rocket science. It's stuff like hiring more staff, opening more beds, increasing funding for emergency departments, maybe fast-tracking credential recognition for healthcare professionals who've moved to Alberta but can't work because of bureaucratic red tape. You know, solutions. Those things politicians are supposed to implement when problems arise. Wild concept, I know. The Alberta Medical Association isn't asking for the moon here. They're asking for basic resources so doctors can do their jobs without having to perform medical triage in a hallway that looks like a scene from a disaster movie. The silence from Smith and her 4 health ministers is particularly interesting when you consider how vocal this government usually is about everything else. They've got opinions on federal policies, carbon taxes, energy regulations, you name it. But when it comes to their own healthcare crisis happening in their own province under their own watch, suddenly everyone's gone full witness protection program. It's giving dog ate my homework energy, except the dog is a collapsing healthcare system and the homework is their actual job. Now some people might wonder why Alberta has 4 health ministers in the first place. That's actually a fascinating question that deserves its own deep dive, but the short version is they split up health portfolios to supposedly make the system more manageable. Mental health and addictions, seniors and community care, health, and affordability and utilities all got their own ministers. In theory, it sounds great. More specialized attention, more focused leadership. In practice, when a crisis hits, it apparently means 4 times the people who can avoid taking responsibility. It's like having 4 captains on a sinking ship and all of them are arguing about whose job it is to start bailing water. The timing of this crisis is also worth noting. We're not talking about some sudden unexpected disaster that caught everyone off guard. Healthcare systems don't collapse overnight like a poorly constructed IKEA bookshelf. This is the result of years of pressure, understaffing, underfunding, and policy decisions that prioritized literally anything else over making sure hospitals could handle patient loads. The doctors didn't just wake up one morning and decide to collectively panic for fun. They've been warning about capacity issues for ages, and now those warnings have turned into a full-blown, we told you so moment that nobody wanted. What makes this whole situation extra frustrating is that it's preventable. This isn't a natural disaster or a global pandemic blindsiding everyone. This is a policy failure, plain and simple. When opposition critics are standing up demanding that the government acknowledge reality, we've crossed from politics into performance art. The bar is literally on the ground at this point. Just admit there's a crisis, show up to answer questions, and direct some resources to the people actually dealing with the mess. That's not radical leftist ideology, that's basic governance. The NDP's call for strengthening staffing is particularly crucial because you can't run a healthcare system without healthcare workers. Shocking, I know. But Alberta, like much of Canada, is dealing with a healthcare worker shortage that makes finding an affordable rental apartment in Toronto look easy. Nurses and doctors are burnt out, some are leaving the profession entirely, and the ones who stay are working themselves into the ground trying to keep the system afloat. Throwing them a pizza party and calling them heroes doesn't cut it when they're drowning in patients and paperwork. So here's where we are: emergency rooms are overflowing, doctors are sounding the alarm, the opposition is demanding action, and the UCP government is doing their best impression of that friend who reads your text messages but doesn't respond for 3 days. The Alberta Medical Association has made it crystal clear that patient care is at risk, which should be setting off every possible alarm bell in a government that's supposedly committed to healthcare. Instead, we're getting statements without accountability, acknowledgement without action, and a whole lot of finger pointing at everything except the actual problem. If you're an Albertan watching this, I'd love to know what your experience has been with emergency rooms lately. Drop a comment below and let's get a real conversation going, because clearly the folks in charge aren't interested in having one. Make sure you're subscribed to Canadian Insights because we're covering Canadian politics daily, breaking down the stories that actually matter without the bureaucratic nonsense. Hit that like button if you think politicians should maybe show up when there's a literal healthcare crisis happening. And share this with anyone who needs to know what's actually going on in Alberta right now, because something tells me the government press releases aren't giving you the full picture. We'll be back tomorrow with more political drama, because let's be honest, there's never a shortage of that in Canadian politics. Stay informed, stay critical, and maybe pack a lunch if you're heading to an Alberta ER anytime soon.